Lord, I thank you for this day. This day is a gift to us, and may we see it as such and take advantage of every breath that you give us on this day. I pray, God, for this commission and the members of this commission. I just pray, first of all, just for your blessing upon them with health, body, mind, spirit, relationships. I pray your blessing on their homes and their families, Lord. I pray that you will give these commissioners wisdom to make decisions that honor you, and in so bring blessing down upon Marion County and the people that live in it. When people are blessed, you're blessed. When we honor you, you graciously and willingly bring down blessing upon the people. So bless these leaders today. Give them wisdom to make great decisions that will be for the best for the people of this county, I pray, Lord Jesus. And we thank you for all of this in Jesus' name. Amen.
Amen. Thank you, Reverend Wilson. Glenda, would you lead us in the pledge, please?
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Glenda. This county commission meeting will come to order. Chris, the first item, please.
We have the acceptance of the minutes from the July 31st, 2019 meeting.
Okay, move that the commission accept the minutes as presented.
I second.
And I'll concur. The next item, please.
We have exonerations 2019 397 through 2019 453 presented by the assessors.
Okay, pursuant to the recommendations of the assessor and prosecuting attorney, move the commission sign exoneration.
I second.
And I'll concur. The next item.
We have waivers and applications for short-form settlements, proposed settlements, and annual settlement reports from the fiduciary supervisor in the following estates: Lewis, Ash, Springer, Harris, Sturm, Workman, Gadd, Rowan, Cunningham, Kuhn, Ingram, Hess, Moore, Hood, Carpenter, Cooper, D'Amico, Hillman, Johnson, Arnett, Harris, Stanley, Wolf, Doer, Potesta, Wells, Mormon, Lynn, Fry, Hibbs, Anderson, Swigert, Zafferman, Brown, and Mullins. And this requires a signature of the commission as well as the clerk.
Thank you, Chris. Is anybody here today with any objections to these waivers and applications for short-form settlements, proposed settlements, or annual settlement reports?
Okay, no objection, move the commission sign the order.
I second. And I'll concur. Okay, Chris, the next item.
We have an order filing petition and setting a hearing date to remove Melissa Rice, administratrix of the estate of Luca M. Grab, deceased, and appoint Joshua Rice as administrator. And that hearing date is September 25th at 10:30 a.m. and this requires the signature of the commission as well as the clerk.
Move the commission sign the order.
I'll second. And I'll concur. And the next item, Chris.
We have a proclamation for Nonprofit Day in Marion County. Whereas since the first federal income tax on corporations was signed into law on August 17, 1894, and included exemptions for nonprofit charitable organizations, which exemptions remain part of the law and have provided significant benefits to the citizens of the state of West Virginia. And whereas nonprofit charitable organizations strengthen communities, address vital societal concerns, and enhance the quality of life for all citizens. Whereas in 2017, Sharita J. Herring a renowned speaker, best-selling author, and business strategist, founded National Nonprofit Day to educate, enlighten, and empower others to make difference while acknowledging those who are in the trenches impacting lives daily. And whereas many citizens of West Virginia, through nonprofit organizations, participate in and organize numerous activities and service projects to improve their communities, and whereas it is important to recognize on a state, regional, and local level the benefits these organizations bestow on our society, and whereas your Community Foundation of North Central West Virginia Incorporated and West Virginia University, in conjunction with National Nonprofit Day, wish to join the residents of North Central West Virginia and Marion County in celebrating the many contributions nonprofit charitable organizations, especially Girls on the Run of North Central West Virginia Incorporated, make to the welfare and quality of life of our citizens. Now therefore be it resolved that the Commission does hereby declare Saturday, August 27th, 2019 as Nonprofit Day in Marion County, and encourage all citizens of the county to support and engage in philanthropic efforts of Girls on the Run of North Central West Virginia Incorporated to make Marion County a better place to live.
Yes, thank you.
Move that the commission sign the proclamation.
Then I'll concur. Is anybody here today? Do we see that you come up front, please?
Would you like to say it?
Sure would.
On behalf of Marion County Commission, we want to thank you all for everything you do for Marion County.
More people taking pictures than the people themselves. Is there a Girls on the Run program in Fairmont?
There is, yes.
Not there, yeah.
Thank you.
Thanks again, thank you so much.
You're always on the
Oh, yeah, please, yes.
Voting was all yours.
You get a side view there?
Yeah.
Good morning, and thank you for this opportunity. My name is Laura Abildso. I am the program coordinator with Your Community Foundation of North Central West Virginia, also known as YCF. Here with me today I have Lisa Fritsch. She is the president and CEO of Agile Technologies, located here in Fairmont. Lisa is also a volunteer member of our grants committee. And so what we're doing this weekend, Saturday is National Nonprofit Day, and this year's theme for our organization is the impact of nonprofits on children and youth. So we have invited nonprofits in North Central West Virginia to celebrate with us on Friday afternoon at the Blaney House. President Gee has graciously offered his home to host this celebratory event for nonprofits. And Mr. Elliott, I hope that you plan to join us. We've sent out invitations to all the commission presidents to attend.
Thank you.
And so here in Marion County, we have 3 organizations that will be honored that day: Girls on the Run of North Central West Virginia, Libera, and the Mountaineer Area Council of the Boy Scouts of America. So we thank you all for helping us to recognize the important work that's being done by nonprofits in our community.
Thank you.
Thank you.
Thank you for everything you do. Okay, Chris, next item, please.
We have a request for the advice and consent of the Commission from Brandy Corley, the Director of the Day Report Program, to hire Melissa Bucklew as a case manager to fill a vacant position at the Marion County Day Report Center, full-time at will with benefits, to be effective August 12th, 2019.
Okay. Move that the commission grant its advice and consent to hire Melissa Bucklew as a case manager with pay for full-time and will benefits. Want to introduce it?
I'll second.
Then I'll concur, and I want to thank Brandy and her staff for the big job that they do over there in our day reporting. Next item, please.
We have a grant adjustment notice from the Justice and Community Services of Supplement Award for 16-VA-066, our VOCA grant, and that is for the record.
For the record, next item.
We also have for the record the Valley Falls Public Service District for reconciliation summary for a period ending 6/30/2019. That is also for the record.
For the record, next item.
We have the opening of bids to hire a qualified real estate appraiser firm for the county. We did not receive any bids for that. So at this point, we can direct solicit whoever we would like to have provide those services for us.
Okay, move that the commission reflect that no bids were received and to move forward with this process.
Then I'll concur. The next item.
At 10:30, we have a public hearing. It might take me until 10:30 to read this, for the consideration of and possible action on a submissions resolution of the Marion County Commission approving the submission of a TIF application to the West Virginia Regional Development Office regarding the creation and establishment of a development district to be designated as the County Commission of Marion County Development District Number 2, TIF District, and a development project plan for TIF District designated as Middletown Commons Redevelopment Project Number 1, the project plan, approving and authorizing a memorandum of understanding between the commission and the developer, and authorizing and approving the taking of other actions and the execution of documents and related thereto. I believe Jay Rogers or someone from Bowles Rice will be here to actually lead that public hearing, but it is not scheduled till 10:30, so we'll wait until then to make sure that anybody who wants to speak at that has an opportunity to do so.
Very good, Chris. Yes, this was taken up and addressed at our last meeting 2 weeks ago, that this public hearing would be held today at 10:30 concerning the tax increment financing project known as the Marion County Commission, actually the County Commission of Marion County Development District Number 2, TIF District, known as Middletown Commons Redevelopment Project Number 1. So we'll hear that at 10:30. Anybody sign up to speak?
No, sir.
Lloyd, would you share with us what's going on at the health department?
Happy birthday to him. Happy birthday to him.
Oh, yeah, happy birthday.
39.
39, I need these. Gentlemen, thank you so much for the opportunity to give you an update on the health department. Let me just kind of update you on some of the things we've been following in the state for a while. The hepatitis A outbreak, as of August the 2nd, we have 2,756 cases. Basically, that's just, it's a statewide. In Marion County, we've had 14 confirmed cases that are epidemiology linked to that particular outbreak. That typically follows all the patterns of, most of those are co-infections with hepatitis C and hepatitis B. But the majority is reports illicit drug use. That seems to be kind of, that's the one that started down in Kanawha, Charleston, Cabell Huntington area, and still we see those numbers now starting to decrease. We did have one case in Marion County confirmed in a food service worker. That's critical when we have hepatitis A in food service employees. And so once we found that out, we absolutely had to exclude that employee. So under the federal guidelines, if somebody reports an illness, you either restrict them or exclude them, depending on the risk. So we had to exclude the employee until such time that she was not no longer in the phase where she could communicate the disease to others. We have since passed 28 days of the incubation period. There has been no new cases, and so we think that only the one index case is the only one that we're going to have. We were able to prophylax, immunize the close contacts of this particular individual. So I think getting that early, the fact that she worked in a facility that really puts a lot of emphasis on personal hygiene through their own training, I think a combination of those is really what caused that to just only be one index case. So I'm confident that we've had no new cases. We're past the incubation period, so I don't think we're going to see anything more with that. So just as an update, the state of West Virginia adopted the new FDA food code, well, the 2013 food code, July 1 of this year. One of the really big changes is more emphasis are put on education and knowledge of the managers. This is a good example here where the employees are required to report to the managers certain symptoms that they have. So then once they get that report, they're required then to do something. And doing something is part of the knowledge. There's a whole list of key knowledge points that they're required to have. So our board developed what we call a person in charge training that complies with the federal guidelines, complies with the state guidelines, and it just helps our operators put a lot more emphasis on basically knowledge, skills, and abilities, and it's all about reducing risk. So public health is about risk reduction in no matter what capacity. So we're real pleased that we were able to make sure that didn't get on. So the other thing is, I think you probably noticed the paper yesterday, and then even in today's paper, Dr. Slimp had a news conference yesterday. There's currently 71 confirmed HIV cases in the Cabell-Huntington area, 1 death. And that we're seeing that probably as a result of the primarily IV drug users, homeless population. We actually sent some nurses to Cabell-Huntington to help their clinic. One, obviously, is if you try to mobilize to, our goal is to keep it there. That's a very difficult challenge because that typically is a transient population. So trying to find those individuals and get them prophylaxed has proven to be difficult. But the other thing, the reason why we wanted to send our nurses down is in the event that we have to mobilize here and do mass vaccinations, we have a little bit better understanding of maybe how that we should be running those clinics. When everyone else is successful, obviously you look at their successes and you kind of mimic that. If it isn't successful, then we simply say, well, we don't want to repeat mistakes of the past. So how can we make sure that our clinics are effective in doing what we should be doing? So far, that is confined to that area. And I just checked with our nursing director this morning. We're not seeing any cases that are related to that. Our cases are still yet extremely low. We did receive, along that line, we received a $41,116 Gilead grant to support Hep C testing. What we found over the last few months is a lot of folks are Hep C positive and may not know it because you can't be asymptomatic. So anyone who comes to our clinic that fit the risk category, we offer Hep C testing. Along with that, we hope that we can also do some HIV, STD testing to see exactly what we have and how we may mobilize to make sure that it doesn't spread. We'll talk a little bit about our harm reduction clinic. We applied for a $99,000, $687 state grant. We also applied for a Hep C grant of $51,592. We have not heard if we were a successful applicant or not. We did, however, receive a $15,522 grant from the state to support those clinics. As of right now, we believe that those clinics can be conducted at no cost out of our general revenue. Our fixed costs are the same, so if we can take those dollars to offset fixed costs, then that's how we can operate that clinic, including purchase of supplies at no cost out of our general revenue budget. Our plans are, if we're successful with that, one of my goals has been for a long time is to have a mobile clinic. And we could use a mobile clinic for a lot of different outreach programs, immunizations, basically anything that we do in our office, we can do outreach clinics. And we've known one of the barriers to healthcare forever has been transportation. So if we can, are a successful applicant and get that and have a mobile clinic, then we'll go one step closer to eliminating some of the barriers for healthcare in Marion County. So our clinics, one of the 2 grants was to expand our clinics. It's like anything else, that you have clinics, we are always evaluating our clinics, what works, what doesn't. If we have a bottleneck, why do we have it, how can we relieve it? So we started on the clinic, we expanded it initially from 2 hours to 6, and then the need was there to expand it further again. So we did get the grant to support expansion of those clinics. A lot of the grants now are not for clinics that are already established, but if you expand those clinics. So that we did expand our clinics, and so far it's working out really well. But I have to tell you, I'm so proud of our staff. Do a tremendous job with those particular. It's a difficult population. They're a transient population. We're seeing about 50% new clients each time, which is fantastic. So we asked them, how did you find out about our clinic and all this and what have you? So we're seeing about a 50% return with 50% new clients. So our clinics are relatively small. We average about probably 25 per clinic. Those numbers are small compared to some of the other counties, but I don't think anybody is mimicking our success. We've had 2 individuals just bring back their supplies and say, I'm done. We're basically no longer going to do it. We had 4 individuals last month simply say, listen, I'm ready for help. How can you help us get help? And then Friday, I work those clinics just because I want to. So I had one young lady on Friday tell me that on Monday she was going to go try to get some help. So that is how we measure success. How do we get individuals from point A to point B so that they may change their lifestyle? And I think it's working. So that's why I know everyone has different views, and I understand that. But our harm reduction clinic is a total harm reduction clinic. We look at all the downstream effects of IV drug use, HIV, STD, Hep B, Hep C, all of those things. If we don't have effective interventions to stop those, we have the potential to lose generations of folks. So that's why we do our clinics. And our clinics are, in my opinion, again, I think we have a fantastic staff that does a wonderful job. And I think all of us at the end of the day in public service, are we doing our best to help those who we have the honor and privilege to serve? That's public service. So that means us sometimes doing things maybe out of our comfort zone, or maybe we don't necessarily personally believe in it, but if we're making a difference, that's the bottom line. That's how we measure success. Can we change lives? We can, absolutely, just by doing the right things. It's pretty much, our environmental health is staying pretty busy. You know, this time of year we're doing a lot of zoonotic investigations as well as some enteric, not a lot. We're still seeing the same cases of Lyme disease that we typically have seen. We're doing some mosquito surveillance along with Mon County to identify, are there any new species of mosquitoes in our area? And if so, what diseases do these mosquitoes carry? But the bottom line is always going to be for us, mosquito control is mosquito control. You do the same for all mosquitoes no matter where they're at. Eliminate basically their breeding sources. So we're working on that to identify, are there any new and emerging pathogens that we need to be concerned with, not today, but the future, and then how we may interact with the authorities to take care of that moving down the future. I do have an opening for sanitarian, so if anybody is interested in applying, the minimum requirements are a 4-year college degree. And so if anybody's interested, they can call me and I can direct them on how to get them to register. So I think that's pretty much all I have. You guys, do you have any questions for me?
No, but I want to thank you for the great job you did of being so vigilant against what's going on. Like I read in the paper today just what you were telling us, so 71, I think, or so cases of HIV confirmed in Cabell County, basically Huntington. Yesterday's paper had 66 or 67. I mean, it's amazing what kind of problems they have down there, and that we don't have here because of our harm reduction clinics and what you're doing to stay on top of that. But thank you for the great job that you do. Appreciate all the hard work you and your staff's done.
You know, I appreciate those comments, and I just have to, maybe I should be careful in what I say, but I think we're seeing in other counties how politics can deter new successes. And that's all I'm going to say about some of those right now.
It may not be popular, some of the things, but we have to take a stance on trying to reduce the risks and the health of the people that come here for our health department. And you do an excellent job. I'm proud to have been a member for many years on the health department, but you did a great job. Thank you for the report. Thank you for keeping us up.
Well, you know, I have to tell you this, we could not be successful in doing what we're doing without all of your support, and particularly yours, Ms. Elliott, over the years on our board, and making some of the decisions that we've made. Certainly understanding they haven't been popular, but they've been necessary for the health and safety of our public, and that's who we're here to serve. So
the results you've given us today and the results that we've had that tells the story that it is working. You keep everything up the way you're doing, and it's working. Thank you.
Lloyd, school starts next Wednesday. Kids looking pretty good early. Everybody getting their shots and stuff.
our immunization clinics are pretty busy, yes, and we did expand over the last few years. We've expanded those clinics because once again, when we do our evaluation of our clinics, what are we doing well? What do we need to improve on, and how can we improve it? So we found over the years that we didn't do a very good job with immunization clinics. We had so many bottlenecks. People would come we had to do our clinic 2 hours a week, and we have a lot of people waiting. So I said, okay, we need to change that. So now we have more of a walk-in clinic throughout the week, and that's eliminated the bottleneck. And so what we don't want to do is obviously have kids not allowed to enter school because they haven't had their vaccines. And so we think we're doing really well with that. So now we're seeing, and probably beginning last month, we're seeing kind of a steady flow of folks coming in now. So I think we're going to be ready. I don't see that not having anybody be able to attend school because they haven't had their vaccine.
Great job.
Thanks for everything. Okay, anybody else, Chris? Anybody else? As always, we'd like to see our elected officials here, Mark Tarr, our assessor, and Wanda Starn, our circuit clerk. Thank you for attending today, and everybody else, department heads, thank you. We will recess for 5 minutes. Did everybody clear the room? They're going to have a public hearing just as soon as we can clear the room, and y'all can stay if you want to. Thank you. Thanks, everybody, for attending today.